With less than 2 months until Election Day, the nation's Veterans Affairs Secretary made 2 stops in Iowa. Dennis McDonough stopped by the National Disabled Veterans Golf Clinic in Riverside, along with the VA facility in Des Moines. Now, truthfully, I wanted to ask him about politics. He was President Barack Obama's chief of staff. Now he works for President Joe Biden. Biden, as we know, finished 4th in the caucuses back when he ran. Iowa Democrats were not counting on him to encourage the Democratic National Committee to keep the caucuses first in 2024. Of course, Obama's caucus win launched him to the White House back in the day, but Iowa Democrats do not expect him to get heavily involved in the caucus fight either. For the record, McDonough's visit was an official one here, so we really couldn't talk campaign politics with him. Secretary McDonough talked about the 2+ years of extra strain VA employees have faced.
The obvious need is the impact of the pandemic. Obviously, the pandemic still informs a lot of what we do. I just sat with 5 high-performing VA personnel here, selected by Darwin. I asked, as I do at every facility, to meet with 5 to 7 of your highest performers. 4 of those 5 are nurses. Okay. They have been working tirelessly throughout the course of the pandemic. And they gave voice to something that I often talk about with providers, but I have not heard it as represented in such a raw fashion as it just was, saying that this has been hard work for 2 years. Among the things we have to think about, she said, is what are we taking home to our families? So to think that this facility and those CBOCs, those community-based outpatient clinics across this region, we had hundreds and hundreds of providers taking that risk on themselves, but also taking it on behalf of their families as they cared for vets. And through that process, we see a dramatic expansion of mental health care through telehealth. That's real life sacrifice. That's something that we're dealing with. Now, how are we dealing with that? Well, that manifests in a lot of different ways, including burnout. So we're making sure that we're investing in increased wages, increased training opportunities, increased growth opportunities. Things like Congress just enacted and the President just signed in the PACT Act, an ability for us to forgive more student loans for our medical professionals who come to work for us.
He also promoted something that Iowa legislators have been pushing, the importance of expanding telehealth services.
Increasingly seeing a dramatic uptake in telemental health from home. So from home or from the privacy of a veteran's car. You don't have to come in to see our providers. You can get our providers by telehealth. That's particularly important for 2 reasons. One, we are making sure that the provision of our care fits into veterans' lives. We're not asking them to build their lives about access to us. We're trying to build access into their lives. So veterans can now take their appointment on their lunch break in their car. The second reason is a veteran who may still feel stigmatized in some way to come in to seek care need not worry about that if they're taking that care from the privacy of their own home.
We also talked about a policy change. The VA facilities plan to offer abortion services in some limited circumstances. The Secretary said that doctors have been warning him that without those services, some pregnant veterans could face health emergencies if they live in a state that bans abortions.
In a state, as you suggest, that does not provide, for example, the intervention, abortion services that would be needed to save that patient's life. That haunted me, obviously, in light of the fact that patient safety is our guiding principle here. So we have, through our rulemaking process, made clear that in emergency cases when the life or the health of a veteran is at risk, and only abortion counseling or abortion services can save that life or prevent that health impact, we will be in a position to provide those services. So that's irrespective of the court cases and the states' rights questions. We provide these services as a federal healthcare provider. We'll do that first and foremost with patient safety, veteran patient safety, front of mind.
Now, Iowa's Republican U.S. senators both told me they oppose the policy change, although they cited different reasons.
The VA, I don't support that if that is coming from taxpayer-funded dollars. So again, we have a Hyde Amendment that prevents taxpayer-funded dollars going towards abortion.
Well, if it had been before Roe v. Wade was overturned, I would say the federal government could do anything because the Supreme Court said it was basically a federal issue, not a state issue. It was returned to the states. So it seems to me it's up to the states to decide where abortions can be performed.
Straight ahead, one party's policy pledges that came without the top of the ticket joining.